Strategy number 6, know your labs. It's common to see normal lab values that differ slightly from what you may have learned in school or with what you see at a hospital or in a book. Laboratory reference values, and even the units with which they are measured, often vary among individual reference sources and are highly dependent on the analytic methods used. The NCLEX will not ask you to answer the questions that requires you to choose the correct answer based on lab values that are only slightly off from the reference range. This is precisely because of the widely acknowledged variation between lab sources. Instead, questions on lab values will be obviously off, or they will test on candidates' ability to analyze the implications of abnormal results and to plan the care of that client. Can you anticipate the manifestations, the risks associated with it, or how to intervene? That's what they will be looking for. As a side note, we have another mobile solution to help with this called Clinical Mastery. This clinical reference tool is made for nursing students and practicing nurses alike. It includes a searchable library of step-by-step nursing skills, diagnostic and therapeutic procedures, CDC and Joint Commission safety recommendations, growth charts, lab panels, vital signs norms, and more. The in-depth labs provide reference ranges as well as detailed explanations of the significance of each common lab value, along with possible causes of a high or low lab result.